Alright guys, let's talk about some of the symptoms of heart failure. So set up our diagram here. So from the left side of the heart, we have blood moving to the tissues that's full of oxygen. Okay, and oxygen is energy that the tissues need to do their work. And moving out of the tissues, we have blood that's full of CO2, which is a waste product. Okay, and that's going to make its way back up to the right part of the heart. Okay, so we need to get energy-rich O2 into the tissues and energy-poor CO2 out of the tissues. Okay, that's going to happen at this spot right here, which are called the capillary beds. So the capillary beds are just a collection of really small blood vessels that are in the tissues where gas exchange can happen. Okay, so exactly like what we're talking about. We're going to move O2 in, and we're going to move CO2 out. All right. So this is exactly what we want to happen, right? We want to get energy in and we want to get waste out. So the way that we measure the amount of blood that's moving over the capillaries is this measure that's called perfusion. All right, and perfusion is the volume, right, milliliters per minute of blood or fluid that's moving over a gram of tissue. So we want to keep perfusion high, right? But when we're experiencing heart failure, the heart is not pumping out as much blood as it should be pumping out, right? So that means less blood is moving through the circuit. That means less energy-rich blood is moving into the tissues, and less wasteful blood is moving out of the tissues, right? So in patients who are suffering from heart failure, they often complain of fatigue. Okay, so if you have a patient come in and say they used to be able to work in the garden for 3 hours straight and now they can only do it for 15 minutes, you should maybe look into the possibility that they're having heart trouble, okay, potentially heart failure. All right, so now let's talk about what happens to our breathing when we're experiencing heart failure. So again, we have the heart, and this time we're going to connect the heart to the lungs. So from our last diagram, we know that CO2-rich blood is moving into the right side of the heart. Okay, that CO2-rich blood is then moving into the lungs, right? And when it comes out of the lungs, magically, it has all this oxygen in it. That blood that has oxygen in it moves into the left side of the heart and then out towards the body. Now, the last time we saw a change of gases, we had a capillary bed, right? So that should be a pretty good clue that there's probably a capillary bed somewhere in the lungs that's allowing us to switch out CO2 for O2. Let's see if I can connect it. Ooh, well, good enough. All right, so there's a little part in the lung. It's basically where all the good stuff happens. Okay, it looks like a little cul-de-sac. Okay, this is called the alveoli. Okay, the alveoli, as you would have guessed, is surrounded by capillaries, and they're right up in there. Okay, so we're going to represent this as part of the capillary that's carrying CO2, and then this second part over here is having O2 in it. Okay, so what's going to happen is the blood is going to come in to the lungs from the right side of the heart. It's going to have all this CO2 in it. Okay, and then that CO2 is going to move into the alveoli, right? And then it's going to be exhaled. Okay, then oxygen comes in, saves the day, moves into the capillaries, okay, and out. Goes into the body and gets pumped out. Now, have you ever played with a water hose? You ever pinched a water hose and noticed that the water hose behind where you're holding starts to get really full, right? Well, that is exactly what's happening here. So let's say we have a problem on the left side of the heart. These vessels behind the problem, let's say it's right here, the problem behind, the vessels behind this problem start to get really big, okay? Let's say that they swell up with all this fluid and they get really big, okay? And we're going to continue the swelling all the way up into here, okay? All right, there's enough fluid in these vessels now that what can happen is you can have some of that fluid cross over, and I'm drawing it in red because I'm trying to signify the danger of it, right? You're going to have this fluid move over into the alveoli and block a lot of the gas exchange that was going on between the capillaries and the alveoli. Right? So when this happens, let's just make sure that we know what's going on here. So that's fluid. When this happens, you're not getting enough oxygen into the blood, and then enough oxygen is not making its way into the body. So you feel short of breath all of the time. Okay? So this is a big symptom, and it's definitely something to look out for. Okay, and there are a couple of other really interesting, unique symptoms that come about because you have these breathing problems associated with heart failure. So one is called paroxysmal nocturnal dyspnea. I know it's a really strange set of words. Dyspnea basically means difficulty breathing. Nocturnal means at night. And paroxysmal means that it happens quickly, or it comes on pretty fast. So what's going on here is that you have the central nervous system that tells the lungs and the heart to relax. Hey guys, relax. And this happens when you're sleeping. Okay? This is why we have the word nocturnal in here. And the central nervous system has a good reason for doing it. You're not using very much energy when you're sleeping, or you're using less than you would be when you were awake and working. So the body says, hey, you don't need to be breathing as hard as you're breathing. Why don't you relax so your breathing slows down? That's all well and good if you don't have heart failure, but if you do, it's going to make it much more difficult for you to breathe at night. So what happens is people wake up, they can't breathe, they're really short of breath, and they're coughing. Okay, so this is a problem that some people who have heart failure have to deal with. Okay, there's another set of symptoms called orthopnea. So for this one, imagine that we have a bottle. Okay, imagine that bottle has some water in it. Okay, imagine that we knock over that bottle. Let's see if I can do it again. Okay, now the water's on its side. All right, now imagine that that bottle is actually a person. It's got a little heart in there. Okay, what do you notice? Now there's a lot more fluid around the heart in this case than there was over here. So there's a bunch of fluid in your legs, basically in all the organs and the capillary beds below your heart. And when you lie down, that fluid can move back up towards your heart, which is basically going to swarm your heart with a bunch of fluid that it needs to pump. And remember, your heart's sick. It's not able to pump as much as it used to be able to. So that's going to cause shortness of breath when you lie down. The last respiratory related problem that we want to look at is what's called hemorrhage. Okay, so hemorrhage is just when blood vessels break. So if we have too much fluid in these capillaries, right, or in these veins, you can actually get rupture, which is really dangerous, and you can have internal bleeding. Okay, so finally, let's talk about some other physical symptoms. So here we have our little man with a brain. The brain, of course, has a ton of capillary beds, has a ton of blood. That blood returns to the heart from the brain via this thing called the jugular. Okay, the jugular is that vein in your neck that pops out when you're really angry or really scared. Okay, and what happens is if you're having heart failure, your pump's not working as well, right? So what's going to happen is that this jugular is going to back up. Okay, and it's going to get really wide, and you're going to be able to see it popping out of a patient's neck when they're just sitting there hanging out. Okay, so if you see them with a really large jugular, which in medical terms you would say that their jugular is distended, okay, that just means sort of bigger than it normally is, right? Then that's an indication that they might be experiencing some heart failure. Let's also look at what can happen in a vein, let's say in the leg. Okay, so there's a vein in the leg, and that blood returns to the heart. All right, let's zoom in here. Let's draw another little box. Draw another little box here. Okay, let's see if I can connect the dots again. Ooh, watch out. I'm getting good. All right, so let's say that we have this vein here. And this vein has water in it. Okay, on either side of the vein, you have some tissue. Okay, we're just going to call it T. Okay, some tissue here. Now, when you have heart failure, you're going to have backup in this vein just like you did in the jugular. So what's going to happen? You're going to get a lot more fluid moving through this vein, but actually it's not going to be moving even. It's going to be moving slowly because you have backup in the whole system. So when enough fluid makes its way into this vein, some of that fluid is going to make its way out into the tissue. Okay? And when that happens, you're going to get really intense swelling in the lower extremities. So I'm just going to show it on his other leg here since we have a little more space over here. All right? So you can imagine sort of it's not that bulbous, but you do have pretty intense swelling. Okay? And this is called edema. Okay? And sometimes it goes by pitting edema, which is a nice adjective because it sort of describes what's going on in the skin. So normally in skin, so this is normal. When you press down on it, it goes up really fast, right? But in pitting edema, just call it pitting, the skin moves back up really slowly. So have you ever seen a memory foam mattress? It sort of looks like that. You know, when you press down on it and it comes back up really slowly, that's kind of what's going on with pitting edema. You press down and the depression that your finger makes sort of stays there for a while. So you kind of leave a fingerprint on the skin, which is kind of interesting to look at. All right, the last thing we're going to talk about is what happens to some of the organ systems. So let's say that this is a little spleen, okay? Well, the spleen, just like anything else, has to get blood and it has to return that blood to the heart. So let's say that this vein gets backed up because of heart failure here. Well, what can happen is the spleen can present as bigger than it normally is. It's going to look big. So you're going to be able to see it much more closely. It's going to be much more obvious on a physical examination than it normally would be. And the same thing can happen over here with the liver.